Hello friends, welcome to Expert Medical Coding. In today's video, we're going to learn about ICD-10 CM PCS updates 2023 fourth quarter part 4. In this video, we're going to cover two coding clinics. The first one is insulin resistant syndrome and the second one is wasting disease or syndrome due to underlying condition. So let's get started with the first one, insulin resistant syndrome. And the update here is subcategory E88.8, that is other specified metabolic disorders, has been expanded to identify type A insulin resistance syndrome and other insulin resistance. So if you'll go to the tabular and search for code E88.8, you can see the expansion. E88810 is expanded as metabolic syndrome. E88811 insulin resistance syndrome type A. E88818 other insulin resistance. E88819 insulin resistance unspecified. Now let us see the question. And the question is, an 11-year-old was seen during an outpatient encounter due to hairiness and melanosis of the skin. After a comprehensive physical examination and genetic testing, it was found that the patient had type A insulin resistance syndrome. The patient was given oral medication and was told to follow for further monitoring of metabolism and androgen levels and symptom management. So what is the appropriate code for TAIRS, that is type A insulin resistance syndrome? So the answer here is we have to assign the code E88.811 for insulin resistance syndrome type A for a diagnosis of TAIRS. So go to the index and search for syndrome as a main term, and below that the subterm insulin resistance type A. It will lead you to the code of E88.811. Go to the tabular and search for this code for description, and the description here is insulin resistance syndrome type A. Now let's go to the next coding clinic scenario, wasting disease or syndrome due to underlying condition. Update here is category E88 other and unspecified metabolic disorders has been expanded with the creation of code E88.A, wasting disease syndrome due to underlying condition. So the code E88 has been further expanded as E88.A. Now the question here is, a patient presented to the emergency department with complaints of weakness, fatigue and decreased appetite with significant weight loss. After further workup, the provider documented cachexia due to severe malnutrition, secondary to the patient's severe dementia with depression. So the question is, what are the appropriate code assignments for cachexia due to severe malnutrition, secondary to severe dementia with depression? So the answer here is we have to assign code F03.C3 for unspecified dementia severe with mood disturbance, E43 for unspecified severe protein calorie malnutrition, F32.A for depression unspecified, E88.A for wasting disease syndrome due to underlying condition. Cachexia due to underlying condition is an inclusion note under code E88.A, which supports the proper code assignment. So if we'll go to the tabular and search for E88.A, so under wasting disease due to underlying condition, you can see the inclusion note, cachexia due to underlying condition. So we can code E88.A code for cachexia due to underlying condition also. Also the code first underlying condition at code E88.A provides sequencing direction, and the underlying condition is sequence first followed by the wasting disease. So if you go to the tabular and search for E88.A code, you can see the code first instruction, that is code first underlying condition. So we have to code the underlying condition first, then we have to code this manifestation code. So in this scenario, the underlying condition is dementia, so that we have to assign as PDX, and E88.A, that is wasting disease syndrome due to underlying condition, should be given as secondary code. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.